Well, here's a quick tutorial on how to do a standard taping technique that's used to stabilize the kneecap and sometimes reduce irritation that comes from the outside. You're going to use two kinds of tape, Hypafix and Leukotape. This is going to go against the skin, and this is going to go on top of the white tape here. You need to find your kneecap, and also you need to have your knee bent in about a 30-degree bend. Okay, preferably you're going to do it on a bed so that you can put some pillows on the back of your knee and it can really relax nicely. All right, I'm doing it in a chair just because of the logistics of getting a camera shot. You find your kneecap, that's hard, and then you just kind of tap and feel until you feel it turn from hard to a little bit soft. That's the bottom edge of my kneecap. And then I'm going to find the top in the same way. I'm going to find the outside in the same way. There you go. I'm going to find the inside in the same way. Okay, and if you want, you can put marks on there for your reference. So you've got a chunk of tape here, and it's cut to a particular length. It's cut so that it'll go about 1 centimeter past the outside edge of the kneecap, and it'll reach just to the back of the knee on the inside, but not go around the back. If it goes around the back, it tends to wrinkle when you bend your knee, and it gives you a bit of, can give blisters. So there you have it. Now, when you take the backing off of this white tape, what you do is you fold it like this so that it doesn't roll onto itself. It's still kind of tricky to get that not to roll onto itself, but it can be done. There we go. Well, it's going to wrinkle when you go on your knee because of the contour of your knee. But you just set it down on the center of the kneecap, let it come to the inside. Okay. And you just brush it down like that. Alrighty. It's also best if you shave the leg before you put the tape on. It sticks better. Now you're going to take 3 pieces of tape. Now I would suggest too that unless you're used to doing this, you remark your knee where it is, because it's kind of important to know where your kneecap is. You're going to take 3 strips. One's going to go dead center and pull the kneecap to the inside. One's going to go cover the bottom half of the first strip of tape, and the other's going to cover the top half of the first strip of tape. So this is going to be cut a little shorter than the white tape. If you really get it right the first time, you can tear the tape, but it's kind of tricky to do that, so you can cut it too. Okay, so I'm just going to put this on the center of the kneecap, top to bottom. You'll see that most of the material of this strip is to the inside. Now here's an important part. You're going to take the skin and you're going to produce folds in the skin by pinching these 2 fingers together. The depth of the folds is proportional to how aggressively the tape is going to pull the kneecap to the inside. So using trial and error, you decide how many wrinkles you want to put in there. Okay, so if you put some wrinkles in, and then you go and you use the tape and it doesn't feel a whole lot different, the next time you apply the tape you should probably have deeper wrinkles. If you put wrinkles in and you find that the tape is more aggravating and your knee doesn't feel as good, well then you take the tape off and then you apply the tape with less wrinkles and not so deep wrinkles. So a little bit of trial and error. Now I'm going to put the second piece over half of it. Doesn't matter whether the sequence here. First one has to be centered and the other ones can be this way or the next way. Wrinkling it up a little bit, laying it down a little bit. There we go. And then the third one, which covers the half of the first strip that hasn't yet been covered, is right there. All right. And that's kind of how you do it. I typically tell patients to wear this during their waking day, take it off in the evening when they're not using their knee very much, give the skin a chance to breathe. Some people have an allergic reaction to this tape. You'll know because it'll be itchy. So if it's itchy, it doesn't mean it's working. It means that your skin's getting red and you better take it off. When you take it off, soak it, hold the skin down, and pull it off carefully. Don't do 1, 2, 3 rip. It'll hurt your skin. Then if you wear cotton pants or wearing long pants, take another strip of white tape and cover the brown tape with the white tape, and then the brown tape won't roll up onto itself. So here's an example of how to get it off. Hold the skin down and peel it off like that, and it's not quite so hard on your skin. And there you go.